We know that these kids are kids that are going to school. They're on your baseball teams. They're, sitting in your churches. These are kids and they're having real issues and real problems, and we want to be able to help come alongside that and really help those kids. When I go into other communities and I say, what services can we help provide for you? This is always the number one thing on the list, is we are struggling with what to do with this burden of mental health and behavioral health. I would love to take the stigma away from that. It's the reason I want it in the Children's Hospital. That is a part of healthcare as we know it, and we want to take care of those kids and help them find a way to know that it's okay, that these are struggles that they have, and actually give them some real tools to hold on to.
I feel like it is such a privilege to work with a mission-driven organization like Covenant Health System in general. And talking with Dr. Thompson and her vision for supporting children and families, no matter what medical issue they are navigating. And we know that supporting the mental health and psychiatric health of parents and families actually makes their other treatment more effective. The mind and the body are interwoven much more than any of us sometimes acknowledge, and supporting the mental health, that relational health, how you relate to yourself, how you relate to your community, can only serve to improve the overall picture and the overall outcomes for our children and families. We have no children's or adolescent inpatient unit for our area. We have no children's or adolescent day treatment or intensive outpatient services. So if a child or family is in extreme crisis, they leave our community and they go very far away, hours away. It is important to treat this as it is, one of the most common issues that children and families face. More common than a broken arm, more common than diabetes, more common than a cancer diagnosis, but often much more functionally impairing for the long run, and really, something that must be addressed and we must take seriously. And so the appropriate place to house it is where people know to go to get care, and that's within the Children's Hospital. I could talk about a kiddo that I have discharged from my clinic, and he came to see me probably about 9 months ago. And he came in, he was on many different medications and was given a serious mental illness diagnosis. And at school he was struggling. His mother came in tears and said, "We've tried everything, we don't know what to do." School basically said, "You're gonna have to find an alternative program for him." He came in to see me, and I knew immediately that he was, number one, on too many medications, and that the medications that he was on weren't the correct medications, that we needed to change them. But we did not have an inpatient service or an intensive outpatient service to do this. When I think about this unit, I think about how much more quickly I could have gotten him and the family the services that they needed if we had a collaborative approach. Everybody worked in the same physical environment, and we had this continuum of services that we could plug him into. Now, at the end of my treatment, Mom looked at me and when I said, "You don't need me anymore," and she started crying. She said, "No," and I said, "You know you don't need me anymore." And she said, "I know we don't." She said, "We are 1,000,000 times better than when we came here." And she said, "Thank you so much." And in my heart, I was very grateful we were able to get there, but I wish we could have done it sooner. I know in an approach, if we have a unit, if we have a program like what we're building at Covenant Children's, we could have helped that family sooner. They wouldn't have ever gotten to that point, possibly, would be my hope. One of the things that hurts my heart every day, and what motivates me to go forward, is that the second leading cause of death for children and adolescents in the United States is suicide, is a death of desperation. That's for 10 years of age and up, 10 to 34. When I think of a 10-year-old feeling so desperate that they don't want to live anymore, and that's almost as common as them dying by a car accident, that is a scary thing. This needs our attention and deserves our attention.
I resonate very much with this vision of what we want to do in this relational health space. My husband and I had the privilege when we were 23, oh my goodness, of adopting his brother. And so his brother came to live with us, and he came to live with us because of a family suicide. And I have spent a lifetime walking with him through this, walking with him through losing his mom to suicide, his bouts with depression, this is happening to people around you. And it's probably the people that you don't think that it's happening to, that these kind of struggles and the reality of behavioral health and mental health issues is a reality.
Children's mental health, adolescent mental health, that family relational unit is an initiative, is the place where we can make the biggest investment in our community. The future is so exciting here. We can do this. We can intervene. What I love about West Texas, and what I say over and over, and especially Lubbock, is that we are big enough to have expertise, to have really smart people doing really great things. We're small enough to get them all together to do it the right way. And that's why I'm here, and that's what I'm most excited about, that Covenant Children's and Covenant Health System in general is taking on this charge to lead the way to fill these gaps for relational health, where treating mental health distress and promoting mental health will no longer be a secret, it'll be a celebration.